Hi, this is Dr. Sai Suresh. Today is the World First Aid Day. So I'm going to tell you interesting tips and facts of the 5 most common emergencies what we see in every emergency department all over the world. So the first emergency, the commonest emergency what we see is chest pain. So the chest pain appears here. First you get on the left fifth intercostal space. So immediately when you do a chest pain, what you should do and what you should not do. When a person gets a chest pain, we misconsider the chest pain as gastritis. We take a soda or we think that it is because of some spicy food. But do not ignore a chest pain. Immediately contact your local doctor or your family doctor, or you should go to the nearest emergency department and take an ECG and confirm from an emergency doctor that the ECG is normal. And then you can take your antacids for gastritis. So when you get a chest pain, do not ignore chest pains. If you are a 40 or a 45-year plus patient and you are having a typical chest pain which radiates from the left side of the chest up to your hands, definitely do not ignore the chest pain by taking soda or antacids. Immediately go to a local hospital. An ECG does not cost much. Immediately take an ECG and confirm that you don't have anything, and then you can return back home. So this is the first commonest emergency. What is the second commonest emergency is fits or seizures. When it comes in children, it's called febrile seizures. When it comes in adults, it's called seizures. What we do is immediately we try to put the patient on a recovery position so that his secretions will not block the airway. So, and you have to take him to the nearest emergency department so that we will give him anti-seizure medications or anti-epileptic medications. So this is the basic first aid, is the recovery position where you turn the patient and keep him on the left lateral position so that the secretions do not get absorbed into his respiratory tract. So, and the third emergency what we are going to deal is burns. There are various injuries or burns which happen at home, where you can get injured from small burns because of from a hot stove. So immediately you have to wash the area. You have to wash it in running water, and immediately you have to apply silver sulfadiazine. It's called silver sulfadiazine. Earlier there used to be Bernol or so many things, but nowadays you use silver sulfadiazine. That is the first aid. And next what we see is poisoning is one of the most commonest emergencies. People due to depression or because of some personal issues, they consume overdose of tablets. So immediately before coming to the hospital, immediately try to make the patient vomit. So you should try to make the patient vomit by giving a solution which contains of salt, and you have to make the patient puke or vomit, so that when the patient reaches the hospital, we again do a stomach wash and take the substances which he has digested. So this is the fourth commonest first aid or emergency where you can do a first aid. And fifth is stroke. A patient, when he presents with stroke, it is very common nowadays for people who have high blood pressure to have a stroke. So what will be the symptoms is FAST: face, arms, speech and time. So if there is face, there will be a deviation. So the face will be deviated, and arms, there will not be movement in the arms or one side or both the sides. And S for slurred speech. So the speech will be slurred. So stroke means it does not necessarily require that he should have loss of movement on the upper and lower limbs. That's all. It can be even a slurring of speech. So the speech will be altered, and the face, while he is speaking, there will be a deviation of the angle of the mouth. And arms, one of his arms he will not be able to move, or his arms will be numb. You should not think that it is a nerve compression or anything, or because I slept the previous night keeping my hand over the pillow. Because of that, immediately you should think it might be a stroke and come to the nearest emergency department, and we will rush you for the stroke protocol, and if needed we will thrombolize and immediately reverse the stroke. So a stroke, 3.5 hours or 3 hours is the window period. maximum of 4 hours. Is 3 to 4 hours is the window period where you should immediately go to the nearest emergency department, and if appropriately treated by a specialist, the stroke will be reversed in 24 hours. So these are the 5 commonest emergencies or the first aid what you can give before you come to the hospital. I wish all of you to be very safe in this pandemic, and always stay safe and maintain social distancing and wear a mask, and a happy World First Aid Day, and try to educate others and do first aid for all emergencies whom you see on the roadside. Give them at least call of 108. Thank you.